Hi, it's Dr. Janowski for Sonata. Today we're going to do a Dysport injection. Dysport, just like Botox, works really great in the upper face, and there's some areas in the lower face you can use it. Today we're going to show some platysmal band injections, so those bands that we see when we exercise and that kind of thing, so people don't like seeing the bands. And if there's muscle behind that band, behind that skin, then we can actually improve the bands. People sometimes get confused because the Dysport units are different than Botox units, but really it's roughly a 3-to-1 conversion. So if you can use 20 of Botox here, it'll be 60 of Dysport. And despite the fact that there are more units that you have to inject to get the same result, the equivalent dose will be less expensive generally than Botox, so we like that. And we like the fact that Dysport kicks in very quickly, 2 to 3 days, and you're starting to see results with that product. So for many patients will describe a longer lasting effect as well. So there's a number of advantages to Dysport. It's injected the same way. I like to use the tiny little 0.3 cc insulin syringes. It gives us a lot of control. It's a short needle. It's a very small 31 gauge needle. And remember, the really important thing is giving the patient a positive experience. So really as little pain or discomfort as we can possibly give. You can use ice before the procedure. Some people who bruise more may use ice. You don't necessarily have to do that. But it's the injection technique itself that really makes it a very easy and quick injection for patients. So I'll start in the glabellar area, and I'm going to use 60 cc's, which is a full 0.3 here. So you can just relax. And fairly typical points here, but we want to inject, put the needle in very quickly and pinch the skin. That actually distracts the skin a little bit. And then when we do the lateral corrugators, we want to come in at an angle because that is superficial and attached to the skin right there. If you're not sure, you can have the patient make a frown face, and then you can identify where that is. So we like to be very, very light in the forehead. So let's have you raise up and relax. So I do a total of 5 units on each side. And that's a really small amount, but it's raise up again and relax. But it's really better to be underdosed than overdosed in this area, because then you will create a brow that feels flat, or the skin over the eye will start to sag. And a way to give a little lift to the brow is just put 5 units in the lateral tail of the brow, right under it, like that. And then we'll go ahead and we'll do the crow's feet. And you can put a little more ice on there. Jeanette tends to bruise a lot. So we'll do a little prep with ice, because that's where you're going to bruise, if you're going to bruise somewhere typically. Okay. And then a smile face and relax. And so we don't need to inject deep. There's no reason for that. The orbicularis muscle, the orbicularis is right under the skin. 2, 3, 4. We're giving her a high dose of 60 units on each side. That's typical dose is 30 to 40 units, so she has a strong muscle there. Let's go on this side, and a little ice here. So just pop that right under the skin. Inject. Don't inject slowly, in other words, get through the dermis, yep, quickly. And I use a little distraction technique with my left hand, where I actually pull the skin onto the needle, and that makes it hurt less as well. So if we take that skin and we just literally drape it over the needle like that, then we can hurt the patient less. Okay, you can put some more ice back on that. Then we've got some platysmal bands, so let's do one at a time. So these are the bands here, and relax. Just grab the band, inject right into it, typically about 20 cc's per band, just right under the skin there. You can follow the band. Good. And it can work quite well for these areas. Good. And one more band. Let's see where it is. We got 3.
I saw 4.
We really don't see. I mean, there's a little one here, so you can go in like that. So those are those platysmal band injections. And so that's it. So it's a very quick process. It should be relatively painless. And we try to minimize bruising with our technique, staying superficial, icing beforehand, icing afterwards, arnica afterwards if you need it. And then results will start to appear in 2 to 3 days. So that's a typical Dysport injection.